As I mentioned before, acetaminophen is our biggest problem. And when we look at our data from acute liver failure study group from 1998 to 2015, you can see that we have not seen any significant trend in changing. We have consistently seen about 30 to 50% cases in our network was related to acetaminophen. And when we look at why acetaminophen or Tylenol, which is commonly called, cause acute liver failure. So in this graph, you can see when someone take acetaminophen, most of them are metabolized by either glucuronate or sulfate pathway. So more than 90% is used by that pathway. And then about 5 to 9% use the cytochrome P450 system and then change into this metabolite called NAPQI. And this has been rapidly taken by the glutathione transferase or GSS transferase and changed into non-toxic metabolite mercaptopuric acid. But then if your system gets saturated, then some of this NAPQI can change into this protein adduct. And this is the toxic metabolite that not only causes hepatic necrosis but also causes kidney injury. And this metabolite of the acetaminophen can cause mitochondrial oxidative stress, dysfunction, and ultimately hepatic necrosis. And this is how we see. Now, this effect of acetaminophen is dose related. And therefore, when we talk about what is the dose that patients with acetaminophen, most of them are taking a very high doses of it, and maybe it's a combination. It's a therapeutic misadventure or accidental that patients are taking acetaminophen separately, and then there are some narcotic prescriptions that also have acetaminophen on top of it. And majority of these patients have either taken 8 to 10 grams of acetaminophen can lead to this point. At the same time, alcohol can compete with some of these similar enzymes, and if someone is taking acetaminophen with alcohol, they can actually develop liver injury even at a lower dosages. Now, at the same time, the doses are safe in patients even with liver disease. Someone is taking 2,000 milligrams of acetaminophen, they would be completely safe to take it. So these patients have taken a very, very high amount, most of the time 8 to 10 grams of acetaminophen to lead that point of liver injury or liver necrosis.